Welcome to Porchlight, a presentation of Porchlight VNA and Home Care, providing top-rate, highly personalized care to individuals and families throughout the Berkshires and also throughout the Pioneer Valley, all in the comfort of your own home. And with Porchlight, it is all about the VNA, but also on the private pay side, the home care side. And that's what we'll be talking about today, particularly as it relates to our involvement in the community in the Pioneer Valley. I'm very happy to welcome to the program Bernadette Duncan, who is from Porchlight Home Care. So Bernadette, welcome to the show. It's great to have you.
Thank you. It's great to be here today.
So you are, first of all, based out of our Chicopee office.
Yes.
In the Pioneer Valley, relatively new to Porchlight, but not new to healthcare, that's for sure.
No, I've had many years of experience in home health care.
So tell me a little bit about your role and what you do for Porchlight in Chicopee area.
Well, I'm the nurse case manager. I go out and I do supervisions on our PCA home health aides for most of our clients that are with elder services. And I also can do nursing visits as well. Sometimes I'll go out and do PT and INRs. Families will ask me to go out and help them. Their loved one is maybe having some challenges in the home, to go out and help them with them there.
And so it's that clinical side of things. It's interesting because when we think of the Porchlight, the home care side, it's
Right.
private pay, but it's all about sort of integrating the clinical with that. So maybe we can talk about the difference between what VNA services are versus what the sort of home care side, which people think is the non-clinical side, and yet there's an integration. So talk about the differences there.
Okay, well, the Porchlight VNA, they provide services to people with Medicare and commercial insurances that require skilled nursing services to go out there, and also provide physical therapy, occupational therapy, all the elements that they need in the home. The integration is where we provide the services of the home health aide with that side to go in and do home health aide services according to the guidelines that Medicare has set forth for them. Say they might need 3 visits a week and have personal care Monday, Wednesday, Friday. So that's where we integrate our staff in with the certified side. But we also service people on the private side, as we discussed earlier. And that is really very challenging, but it's a wonderful service that we can go in and provide for the families. Whatever they need, we go in and we do an assessment, and then we determine what hours they're going to need for coverage. And I think it's a wonderful thing that we can go in and offer the families an alternative to care.
So it's interesting because, with that private pay side, again, it may not be a major illness that someone has, but it may be something that basically allows them to, first of all, stay in their home.
Absolutely.
Whereas they're, as opposed to alternatives like assisted living and that sort of thing. So it may not be a major illness, but it's giving an individual that boost to just get that little extra service that they need to be able to stay in their home.
Well, sometimes it's more than just an hour or two. We do 24-hour care. We also do live-in services, which a lot of agencies don't provide for care, and it helps the families make a decision if they need someone there 24/7, but also be cost-effective for them. I feel that it's an honor to be in their home and to be able to offer those services, whatever they need and whatever their choices are at the time that I'm there. I had a family member call me because her father was in crisis, and I went to the home, and he was, and I just asked him to trust me and that we would work through it, but I did have to send him out to the hospital. But then when he came home, we were able to work with providing services for him every day, including taking him to the doctor's appointments and things like that. She also asked me to attend a doctor's appointment as a nurse, so that was a nurse visit as well as an aide taking him there and getting him there and bringing him back home. So we are allowed to keep them safe and healthy in their home as long as possible.
So one of the aspects that's very helpful for a family is because at this point many caregivers are those daughters and sons and family members who no doubt want to do the best for mom and dad, but of course everyone has their busy lives, they have full-time jobs, they have families and so forth. So that's something that, you always have to weigh the options and also think about it. That's where Porchlight is a good opportunity for people to think about these services.
Yes, and the thing is I was a caregiver for 15 years, so I understand the challenges that they have on a day-to-day basis. And I think it's very important that they understand that Porchlight VNA Home Care is there to help them make those choices, provide resources, and provide all the support that we can give them to either remain at home, and most families, if you talk with them, they would love to keep their parents at home. And that is one of the goals. If that's what they ask us for, that's one of our goals, is to make sure we provide quality care, we're compassionate, we provide caring caregivers to come in and be a visitor basically in their home, but be part of the family and help them out through those day-to-day challenges.
And for Porchlight VNA, and of course, healthcare is this world. Now, we both know healthcare
Yes.
very well,
Yes.
but looking from the outside, it can be very, complex, and also it's just kind of, for a lot of people, it's sort of like a wild west. What's the difference between home care and VNA services? What's the difference between nursing homes and assisted living? What's the difference between hospital care and so on? But when it comes to the area of home care, I think that it's important for people to understand these differences, and also as a small freestanding nonprofit, which formerly Chicopee VNA and Great to Be Home Care
Yep.
merged with Porchlight out of the Berkshires and so on. So for you, part of that is getting the word out and the message out about what Porchlight does. So you've been very active in the community.
Absolutely.
In doing that. And as a nonprofit, that's part
Yep.
of our mission. So, tell me about some of the things you've been doing to educate the community about not only what Porchlight does, but also how the healthcare system works, and sometimes
Yeah,
it doesn't work.
Right. Well, I think it's wonderful because I think it's very important for us all to be part of the community and offering everything that we can for a healthy lifestyle. I've been involved with the Springfield Housing Authority. I work closely with Canada Crips, and what we do is we provide blood pressure clinics, diabetes workshops, Alzheimer's, dementia workshops. We can offer that. I did do the training for that through the Alzheimer's Association. In addition to that, we did an American Red Cross blood drive. We are now doing some community service with Lorraine's Kitchen. We're providing food for the needy, and I think just getting out there and helping people is a wonderful thing from day to day. If you can help one person change a little bit of their lifestyle, I think I can really be happy about the day that I've worked with them in the community. I love community service, so that's one of my passions. It's not just marketing, but it's really community, getting out there and knowing people and offering the services that Porchlight VNA and Home Care can offer. And that's great quality care. We have challenges every day, and families have challenges every day, but if we can work with them to get through those challenges and maybe have a brighter day for tomorrow, I think that's wonderful.
And looking at that as part of the mission, because Porchlight has worked with departments of health,
Yes.
The municipal boards of health all over Berkshire County. I'm sure extending that into the Pioneer Valley as those relationships continue and grow. Things like blood pressure screenings, but also support for municipalities on flu shots and that sort of thing.
Yep.
I mean, really is integrated into the mission, the nonprofit mission, knowing that when you are investing in not only services, but when you are taking your dollars, that when you with Porchlight, those dollars are going back into the community.
Absolutely.
And there are a few programs that Porchlight does where those extra dollars is enhancing the care. We talk about the telemonitoring systems that we have out in the Berkshires and throughout Porchlight's coverage area. Those types of things that maybe if it's a for-profit, those dollars go into the shareholders' pockets.
Right. Absolutely. Absolutely.
So that's an important distinction to make.
It is, and I think it's a wonderful distinction to make. With Porchlight VNA and Home Care, I think it's wonderful to be out there and representing wonderful people, quality care, and I have the best job ever, I believe. I really do, because I get an opportunity to go out and meet with the families, discuss what their wishes are, and meet the client and understand what they're going through, what their challenges are from day to day, and be able to provide the help to get them through those challenges from day to day. That is just a blessing.
And one of the things that we love to do at Porchlight is to be able to recognize those great stories.
Right. Yeah.
Because I think one of the most important ways to really tell what you're all about is to be able to tell the stories of those patients who of course, they all predominantly most patients with Porchlight do very, very well, but especially those exceptional cases, we love to highlight those on Profiles in Care. And I know that you've had many of those individuals that you've said this is a great story to tell, but that's important.
Yes.
Because I think it's part of the education as well, because no one expects to have to be in that situation. And often it means that people don't always plan for these situations until you kind of come right up against it.
Yes.
And that's one of the challenges we always have, and I don't care if you're in hospice care or if you're in the nursing home world or whatever, home care, it's one of those challenges that you as a caregiver and as a manager of the situation deal with, is that people are making these important decisions without necessarily a lot of time to make the decision.
Right, right. And it's always, it comes down to the family and the client when you meet with them, and giving them the choices on what their choices and what they want, and their wishes, what they want. And when it gets to where it might be the end of life, you want to make it as comforting as you can for those families. And for the person that actually is, in the end of life.
Right, and of course,
that's the most important thing.
And for Porchlight, that range is, you have individuals who, in fact, I just had a conversation with someone who just had their knee replaced.
Yes.
And it's, it's not about anywhere near end of life for
No,
that person.
nope,
It's all
nope.
about getting back on their
Yes,
feet.
yep.
Going out golfing again
Yeah.
because she's retired and wants to enjoy her life. You know,
Yep.
that sort of thing. And there's
Yep.
so much of that.
Yes.
And all of it happening where you'd prefer it to happen in the home. And
The
that's
physical therapy.
Physical therapy. And
Yeah.
that's so important for a couple of reasons, in my opinion, is that, first of all, you live in your home.
Yes.
So how important is it to be able to maneuver yourself in the place where you are the most, in your home? That's important.
Right.
And then the other thing, there's a comfort level there that in fact, this patient talked about the fact that they knew Porchlight was coming. They didn't have to worry about expending all the time and energy that it takes in doing the logistics of, okay, I have to be at this outpatient facility
Center,
at
yep.
this point, and
Absolutely.
then I have to go get my blood drawn at this location, and that sort of thing, where they can be home.
Yes.
Going back to the old model with house calls, and that is a very valuable thing.
Yeah, it is very, and it's important because the physical therapist can go in and actually look at the home and make modifications to make it easier for them to manage, their day-to-day life.
No doubt. So tell me about your background a little bit.
Okay.
Home care perhaps is not not the only area you've worked in. Healthcare, you've seen quite a bit. So tell me about what brought you into healthcare for
Well,
profession.
okay. I started as a caregiver years ago, many years ago, and as like a PCA and CNA, and did home care in the Connecticut area for many years, and then went on to nursing school. That was one of my best choices that I made, because I was working in systems analysis and design, and I wanted to get back into the caring, the hands-on, and going into the home. So I've worked in many capacities. I've worked in adult day centers. I've worked as a triage nurse. I've worked in long-term care. I've worked in assisted living. I've worked in pediatrics and geriatrics. I did Bristol Head Start. Done the full range, but I always come back to home care.
Yeah.
That's where I really love it. And the reason why I love it is because I ended up having to take care of my grandmother for 15 years in my home. So home care was my passion. And and I had wonderful caregivers to come in and take care of her. So I guess that experience has kept me coming back to home care. And I've been in home care in three different levels.
And so you have those conversations with these families.
Yes.
What are some of the most common questions that come up, or even misconceptions often that you have to sort of dispel as people come into this? Obviously, there's a payer side of things
Yes.
that is always a concern, and rightfully so. But then some of the issues about what services actually do, what they provide, what they don't provide. So
Right.
tell me about some of the there's no prototype conversation that you have, but I'm sure there are questions that do come up often.
Absolutely. Well, the financial part of it, you go over that with them. I don't get into too detailed with how much they have, but can they afford the home care? Do they have long-term care insurance policies that might be out there that we can review and maybe add services to that? Other ways to getting services is through the certified side, if insurance will cover that, depending on what their needs are. And we look at all of them, and we all work together to figure out what's best for them, because we also have the VA. You got to remember the veterans. And I think it's an honor to go in and take care of those veterans in their home. Those type of things.
So
but we
part
can
of
provide
your role, of course, is to have them understand what
is available.
is available
Yeah.
for them, which is so very, very important. And you
Absolutely.
talk about, we hear on the news all the time about our VA services and
Yes.
the challenges,
And they are
to put it
challenges.
lightly,
Yeah.
that are there. To have an advocate to be there for a veteran who said, you know what,
Absolutely.
you have benefits that you have earned. We're going to help you and guide you through the process. And then, like you said, for individuals who may qualify for the clinical level services, then it's appropriate to be referred in that direction. So some of that may be covered by Medicare or what
Absolutely.
have you. So these are all things that a family coming in, I mean, it is totally
Overwhelming.
foreign soil to
Yeah,
them,
yeah,
really.
overwhelming.
And you really need someone. And of course, I know Elder Services is very helpful, in the Berkshires.
Absolutely,
And
absolutely.
the same in the Pioneer Valley.
Absolutely. And the intake at Elder Services is wonderful because they have so many more resources available, and they also have a directory. I don't know if you know that, but Elder Services has a directory of services as well. So those are the things you look at, and I do have contacts in that office that I can call them and ask them, where can we better service this client, in what areas, and what do they qualify for? Because you got to remember, qualification is also finances. Where do they qualify? Where do they fit in to be able to tap into those resources? So that's important. We provide a lot of variety of, we can do housekeeping, we do companionship, homemakers, PCAs, CNAs, supportive home health aides. We also have care management. We do a courtesy assessment
And that's
in the
important
home.
because I think,
Yeah.
some of those things, again, like it doesn't, housekeeping
Right.
and that sort of thing, it doesn't sound healthcare-ish.
Right.
But, it's those little things that will often be the,
Hygiene.
helping someone pay their bills.
Right. Right.
Things like that in that particular case where that's a challenge. And I've seen, in some cases where Porchlight has done that type of work because
have.
because in the end, it is important to keep someone in their home. That's the philosophy, and it's a more efficient way of things. It's a higher quality of life for those individuals, and
Absolutely.
that's always been what the family wants. And you hear it from every, elected official who says the same thing. Whether the investment in that philosophy follows suit or not, that's a question for other people. However, that is the overriding philosophy, and I think we all believe in it because of real experience.
Absolutely, absolutely. I think it's wonderful. It's just a wonderful thing to be a part of every day. Every day.
And so, how do you see, Porchlight sort of, evolving? We know that hey, it's a merger between
Yeah.
two organizations that have
Yeah.
such a wonderful history, and we're still. I mean, again, it's it feels a little old hat because it was about 6 months ago or even more that this merger took place. But
Yep.
still, it's you always want to think, well, it's kind of like what's the next step? The great care continues to happen.
Continue to be out in the community, providing services to these people, some of them that need the service. just the other day I was at the blood pressure clinic, and someone had a very high blood pressure, had to be sent to the clinic for their physician. Didn't know that it was that high, but it was very high. So, you know, those are the things, being out there, working with the community. I think that sets, you know, lets them know about Porchlight, what we're all about, and how we care, and we offer that quality of care, and how compassionate we are for the families, and what they do day to day. You know, I think it's important.
It is.
Very important.
It is, and obviously you're very passionate
Yes.
about it.
Yes.
And so again, and from other places that you have worked, you're still relatively new to Porchlight. But how would you describe this organization, you know, within this sort of healthcare realm, and you know what Porchlight means, you know, from a reputation standpoint and history, and just the people you work with every day?
Professionalism.
Yeah.
We have wonderful nurses. We have wonderful staff in the office. You know, I just think I have a wonderful group of people working with me. If there's something that we need, there's always someone there to help us or guide us in the right direction. And what's best for the client is the most important thing, and I think Porchlight stands for that. Giving them the choices and the options, and deciding on how they want their care to be.
Well, Bernadette Duncan, a great pleasure having you
Thank
on
you.
the program. How can people get in touch with you? Of course, you're in the Chicopee office, but
Yeah.
but again, you know, anyone watching the show in the Berkshires or elsewhere want to get in touch with you. How can they get in touch with you?
They can go on the website, or they can contact our office, which is, our office number is 413-593-6962. My extension is 154. If you have any questions, you can give me a call at any time. I'm here to help everyone that does make that phone call. You know, there's the main number too, which is 413-437-9862.
You're just rattling them
so
off, aren't
yeah,
you?
yeah. And then
of
I
course,
also
in the Berkshires, the number
Yeah.
is 413-243-1212. All
Yep.
those numbers, of course, are online.
They are.
PorchlightHomeCare.org.
Yep.
It's been such a great pleasure, Bernadette. We love
Thank
the
you.
energy
Thank
that
you.
you have brought to Porchlight, and you're so active in the community, especially in the Springfield
Yep.
area. It's really exciting to see that, and
Thank you.
it is all about that professionalism and great passion for what you do. So
And-
thank you very much.
And thank you for having me. It's been a pleasure.
Anytime, Bernadette.
Thank you.
Anytime. Thank you so much.
Thank you.
And this has been Porchlight, a presentation of Porchlight VNA and Home Care. I'm John Krol. Thanks for watching.